claim that I'll be responding to today was by Jacqueline Estrada, and her major claim was that abortion causes physical and mental health risk among women. Her secondary claims were that abortion can cause depression and substance, followed by her secondary claim, which was abortion can lead to suicide, and her last secondary claim that abortion can cause death. Now, to address the first statement, that was abortion can cause depression and substance, I'm going to claim that abortion can't be categorized as a cause for depression and substance. To challenge her evidence that she had research on, the 25-year study of the increase in depression and substance of women who had abortion, the data that was recorded, she didn't give us exact dates of when the data was heard, therefore it could not be a reliable source because it could have been taken a very long time ago. And according to the American Psychologists Association in 2009, an abortion can't be a cause of a depression because there's no scientific or ethical research that has proven that abortion is a cause of mental health. And according to Carolyn West, Dr. Carolyn West of the University of Washington, she states that mental health problems that develop after an abortion may not be caused by the procedure itself, but instead may reflect other factors associated with having an unwanted pregnancy or antecedent factors unrelated to either pregnancy or abortion, such as poverty, a history of emotional problems, or intimate partner violence, which proves that abortion, the depression and the substance is not necessarily factored by the abortion itself, but it could be the outside influences as well. Now, to respond to her second secondary claim, that was abortion can lead to suicide. I claim that abortion and suicide don't have any connection to each other. Her study on the LA study was that there was an increased rate of suicide because of abortions, but again, there has been no scientific proof that abortion and suicide are linked together. And she also said that there are numerous health risks that go along with getting an abortion, but she did not list any of the health risks, so how are we informed of those? And according to Dr. Jen Gunter, she states that with multitude of studies showing no link between abortion and suicide, to claim otherwise is willfully disregards science and favors one's own personal belief system. So this is more of a personal opinion rather than actual data given that can prove that abortion leads to suicide. And to respond to the secondary claim, abortion can cause death, I'm going to claim that abortions are less likely to cause death in the early stage of pregnancy. Because although it's true that abortion can be a factor of death, giving birth can also cause death. So it can go both ways. It's a two-sided subject. And according to the Center for Disease Control, they concluded that before 16 weeks, abortion is safer than childbirth, and the risk is they're both equal at the time of 16 weeks. But as the time goes by, it is more of a chance that abortion will be a higher chance to cause death. And today I have claimed that abortion can't. I have tried to refute the claim that abortion causes physical and mental health risks among women cannot be necessarily true because there's no scientific evidence behind it. Thank you.
All right, you label the secondary claims pretty clearly. The first point basically makes this kind of interesting challenge to the evidence about the dates, and I'm not sure that that gets you very much. I'm not sure that it means anything without some context. Your criticism is that the advocate didn't provide any dates on that information, and I think that's okay. Later on, though, you've got some arguments that I think could provide some dates as well, and so we need to make a little bit more comparison that's going on here. The second quote is from the American Psychological Association, I think is more useful. The problem is that it's not, doesn't sound like it's a direct quote. It sounds like you're paraphrasing, and I think that the direct statement is going to be a lot more convincing than your summary of what they're saying. So you want to be careful about that and make sure that you're quoting somebody directly. The third piece of information comes from West, and they basically are offering an alternate causality explanation that there may be other reasons. They don't provide any evidence that this is in fact the explanation. They just give a set of potential claims. So I think that it's a good argument, but there ought to be some proof that, in fact, it's likely that any of those would be the reason that people would have problems. For example, if you could show that people who are in poverty or who have emotionally stressed relationships are the ones who seek abortions most frequently, then that would be information that I think would make that argument a lot stronger. The second point basically says it's not true, it's not true, it's not true, and it's not true. If there's something wrong with the advocate's evidence, tell us what's wrong with the advocate's evidence. The only thing that I get from you is I have a quote that says there's no link, and suggesting that there is a link when there's no link means that you are dealing with your emotions rather than the proof. Okay, well, that's a very generic statement. It's not specific to either the advocate's evidence, and it doesn't provide any counter evidence except for the opinion of that particular person. And if you want that to be convincing, you need to tell us why that person's opinion is valuable. Otherwise, it sounds like it's the same kind of thing that they're talking about. On the third point, the death issue, I think you do need to explain, for instance, the frequency with which abortions are done prior to the 16th week versus after the 16th week, since that is the argument. If we're talking about risk factors here, if the vast majority of abortions are done before the 16th week, then it seems like the risk level is relatively low, and that women seeking abortion after the 16th week, there's probably some exceptional health condition that requires that, and that in fact becomes the explanation about why there's a danger to them, not the abortion itself. All right, thank you.